Hi, it's Mary, and a traditional Chinese medicine tutor and an acupuncturist in Canada. Today's video will discuss how to select the 5 Shu transport point according to the 5-element theory. After the discussion, you will know how to use the treatment principle of reducing the excess and strengthening the deficiency to select the mother point, child point, or 本穴, which is channel rep, from the same channel or the other channels to treat diseases.
The 5 Shu transport points and their 5-element natures.
In acupuncture moxibustion therapy, 5 Shu transport points are frequently used to treat meridian and Zang organ disorders. The 5 Shu transport points are distributed distally to the elbow or knee joints, namely Jing-Well, Yin-Spring, Shu-Stream, Jing-River, and the Hersey point. Among them, the meaning of Jing in Jing-Well, Yin in Yin-Spring, Shu in Shu-Stream, Jing in Jing-River, and He in Hersey point are all Chinese pinyin having the meaning of well, spring, stream, river, and sea, respectively. The body's qi and blood floating in the channel is like water coming out of a well, forming a spring, merging into stream and the river, and converging into the sea, where the channel qi moves from shallow to deep into the body and gathers in the Zang organs. The 5 Shu transport points not only describe the channel flow from shallow to deep, but also have the 5-element natures. When we match the 5 Shu transport point of yin channels of both hand and foot to 5-element, Jing-Well points belong to wood, Yin-Spring point to fire, Shu-Stream point to earth, Jing-River point to metal, and Hersey point to the water. When matching the 5 Shu transport points of yang meridians of both the hand and the foot to the 5-element natures, Jing-Well points belong to metal, Yin-Spring points to water, Shu-Stream points to wood, Jing-River points to fire, and Hersey points to earth. The yin channels, the Jing-Well point has the nature of wood. That's the difference you need to remember. For the yin channels, start with the wood, then go along the 5-element system: wood, fire, earth, metal, water. Go this way. This is for yin channels. For the yang channel, start with metal. The nature of the metal for the Jing-Well point. After you know the starting point, then you just following that. Jing-Well is the metal. The next Shu point, Yin-Spring, is the water. So metal, water, wood, fire, earth, go like this. This is the one we need to remember at the first place. It is following the sequence of this circle. This chart shows all the 5 Shu transport points for each meridians and their related 5-element natures. There are 60 points in total. Which one to choose from? Knowing each meridian's mother point, child point, and 本穴, the rep of the channel, is a fundamental skill for an acupuncturist. The principle of selecting the 5 Shu transport points is to reduce the child point for excess problems and strengthen the child point for deficiency problems to restore the yin-yang balance. Of course, syndrome differentiation to identify the type of disease belonging to excess or deficiency is a prerequisite. There are two methods of selecting the 5 Shu transport points according to the 5-element theory. 1. Choose the mother point or child point from the involved channel itself. 2. Choose 本穴, the channel rep, from other channels related to the affected internal organs.
Let's take shoulder pain as an example.
After you know this, then you will do your syndrome differentiation first. For example, if people has a shoulder pain, there's so many channels go through this area. There's a large intestine, triple energizer, small intestine, and also on top, the gallbladder channels all go somewhere through this area. If it's front pain, it will involve lung channel, pericardium channel, even heart channel. They can all go through those areas depending on where is the pain. Now, let's suppose this person has a pain on top of the shoulder. You will know that top of the shoulder, that's where large intestine goes. Now you know it's the large intestine channel involved. You need to identify next is it's an excess or deficient problem. If it's an excess problem, usually the pain, it's a very sharp, constantly 24 hours non-stop has pain. If you push it, it feels much pain. The pain is worse. Usually it happens like within 1 or 2 weeks, the pain will be the excess. But with time, the pain go deeper. It usually becomes a deficient type. For deficient type, the patient will say, oh, I don't feel that much pain. Sometimes I feel pain, but most of the time I don't. And they will say, if you press on it, I feel comfortable. They like to be pressed. That situation usually indicates that it's a deficient problem. From there, after you gather those information, made your conclusion, you can start your treatment. Let's say this patient has a sharp pain, just had damage to the shoulder for about 2 or 3 days. So we say it's an excess problem. If it's an excess problem, according to our principle, you will going to reduce the child. So for the yang channel, this is the yang channel. For the yang channel, a large intestine itself belongs to the wood. Now it's excess problem. We are going to reduce the child. In excess problem, we reduce the child. We know the child of the metal is the water. For the large intestine, the water point is the spring point. So it's the 二间 large intestine 2. In this situation, you can choose this point. The way of doing is you get the needle in, get the needle sensation. It's reducing already, because the point itself has the nature of reducing. This is the child point to the large intestine channel. By needling this point, got needle sensation, it's reducing already. If you can add the reducing technique, therapeutic effect will be even better. For a large intestine channel, the 二间 is here. We know the large intestine channel is going downwards. I mean from the tip to all the way to the head. Go this direction. If you're needling, using the technique, for example, you turn the needle against the flow of the direction, or when you insert the needle, not perpendicular, but go obliquely insert into the point. It's reinforced the effect. It has a double effect on the reducing effect, because we know very clear we want to reducing it. So you can choose many different ways. Or after you 得气, you insert the needle, push in a little bit. Also has the reducing therapeutic effect. So that is for treating the excess type of shoulder pain. If it's another case, that's the deficient type. This person has shoulder pain for several months. It's not that aching, but they feel it sometimes. So if that is the situation, you can choose the mother point of the large intestine channel. The mother of large intestine is the earth. The earth is the mother of metal. So you look at this one, the earth point is the 曲池, large intestine 11. Large intestine 11 is in the elbow, in this area, the elbow area. When you choose this point, if you just 得气, only 得气, by get the qi sensation, it's already strengthening. On top of that, you add the strengthening technique like you turn the needles in a way following the flow of the meridian. Or when you do the needles, when you get the needle sensation, you pull up a little bit, also has the strengthening technique. This one is for helping to treat the deficient type of problem. Sometimes patients even come to say, oh, I have pain. Sometimes I feel pain, but sometimes I feel just sore. That's usually an indication of a combination of excess and deficiency. In that situation, you can choose both the mother point and the child point, treat them together. However, you need to know which one dominates. Major times very sore, but sometimes very pain. If that is the case, you know deficiency occupies the most, dominates, but with some excess. In that situation, you are going to focus more on needling the qu-chi, large intestine 11, because this is the mother point to tonify part. After that, you can choose large intestine 2, 二间. This is the child point to do a little bit reducing. Okay, there's a combination. People has excess and deficient together. Of course, another situation would be there's a lot of pain, but sometimes feel not that much. There's a break a little bit, feel a little sore. Most of the time feel a lot of pain. If that is the situation, your needling will focus on 二间, large intestine 2 first. More reducing combined with a little strengthening in the large intestine 11 qu-chi. So that's the combination of it.
Doing reducing or strengthening on the benzu, the channel rep.
Another way of doing so is if you say, oh, that's too complicated, let's find an easy way. Yes, you can. So for large intestine is a metal. Among the 5 Shu transport point, there's one point share the same nature as the meridians, which is for the large intestine, the metal one is Sao-Sang, large intestine 1. Large intestine 1 has the metal nature. It has the same nature as large intestine meridians. So this one, in Chinese, we call it 本穴, means this is kind of like a representative. You can think about it, the point with the same nature as the meridian is the class representative. He represents the nature of this channel. So in that situation, if you want to make it easy, you are going to choose this point, large intestine 1, to do the reducing or strengthening. If there's a deficient type, you're going to use the strengthening method. And if it's a excess type, you use a reducing method, but the way of doing it is on the same point on large intestine 1. At this example, large intestine 1 is here. Zang, you dare not to do this kind of, by theory, you're okay to do the reducing and strengthening, but you know it's hurting on this point. That's Jing point. All the points on the fingertips are very sensitive, you know it, very painful. If you choose to do this point, for strengthening, you turn clockwise 9 times. For reducing, you counter clockwise 6 times. The therapeutic effect should be good, but the patient will hate you. That's too painful.
Alternative points for needling Jing-Well point.
The way of doing so, there's an alternative. If you tonify the Jing point, instead of tonifying the Jing point, you tonify the He point instead. You need to tonify the large intestine 1, but it is a Jing-Well point, too painful. You can choose large intestine 11, the He point, to tonify it. If you're reducing the Jing point, you can reducing the spring point instead. So instead of doing reducing technique on large intestine 1, you can choose to do reducing technique on large intestine 2. This principle applies to all the meridians. If you somehow you need to needle the Jing-Well point, you can apply this principle, which is instead of tonify the Jing-Well point, you tonify the He point. Instead of reducing the Jing-Well point, you reduce the Yin-Spring point. So that's how you use the 5 Shu point to choose acupuncture point.
Select Benzu channel rep from other channels to reduce or strengthen.
There's another way of doing this. Instead of choosing the points from the same channel, you can choose different channel to do the same tonifying or reducing. For example, the liver has a problem. After our diagnosis, we find out that it's a liver deficiency type of a problem. For liver deficiency, we need to tonify the mother. The mother, by the 5-element theory, the mother is the kidney. The kidney is the mother. We're going to tonify kidney, but which one? Kidney has so many points. Which one should we choose? We choose the cross representative. Choose the 本穴, the point represent that meridian. So for the kidney channel, kidney belong to water. In the 5-element system, the Hersey point is the water point for the kidney channel. That makes the Ying-Gu Ki10 the representative of the kidney channel. So in order to tonify the liver, you can choose Ying-Gu Ki10 to do this work. If it's a liver excess problem, the liver has excess problem, you need to reduce the child. The child of liver is the heart. The wood promote the fire, so heart is the child point. Heart belong to fire. We are looking for the representative of the heart channel. That is the point has the nature of the fire. The Fu, which is here, you make a fist and you see in between of it, that's the Fu. This point has the 5-element nature of fire, so this one is the representative of heart channel. You can reduce the Fu heart 8 to treat the liver excess type of problem. There's many varieties for you to choose. Of course, if you want to choose the same channel on the liver, it's fine. For example, in the deficient type, you can choose the Ying-Gu 10, but also you can choose the liver 8 Qu-Quan to treat, because Qu-Quan liver 8 has the nature of water, is the mother of the liver meridian. If it's an excess type of liver, other than reduce the Fu heart 8, you can also choose the Xinjian liver 2, because liver 2 has the fire nature, is the child point of the liver channel. That makes your selection very wide.
It's quiz time. A patient has food retention for today's. Your diagnosis is stomach excess. Which of the following points can you choose to treat this condition? A. Zusanli ST36. B. Lidui ST45. C. Kneading ST44. D. Jixi ST41. E. Xianggu ST43.
What you can do is the same. For example, let's say the food retention is related with the stomach. For the stomach, that's the Yang channel. We know stomach is the Earth channel. You can directly reduce the point has the nature of the Earth, or reduce the meridian representative, which is the Zhu Sanli, ST36, because ST36 has the nature of Earth. That's the representative of this channel. You can directly reduce ST36 to treat this problem. But of course, you can also reduce the child point of the stomach channel. The child of the earth is the metal. The metal is the Li Dui. Well, that's the Jing-Well point, right? The ST45 is the Jing-Well point. So you can reduce this one. But this one is painful. So instead of reducing the Jing-Well point, we can reduce the Yin-Spring point, which is the Nating ST44 instead, which makes ST44 very useful point for reducing the stomach excess. If you understand this, you can freely choose points either from the same channel or according to the relations of the 5-element theory to choose the points from other channels as well.
So, the answers are A, B, and C. Have you answered correctly?
We just discussed the principles of selecting the 5 Shu transport points using the theory of 5 elements. However, other than using the 5-element theory, there are other angles to consider regarding the 5 Shu transport points. For example, according to the spiritual pivot, in the spring, needle the Yin-Spring point. In summer, needle the Shu-Stream point. In autumn, needle the Hersey point. And in winter, needle the Jing-Well point. We will discuss the application of the 5 Shu points in a separate video. Nevertheless, using the 5-element theory to guide the selection of the 5 Shu transport point is a commonly used method in TCM practice. If you find this video helpful, please give me a like, subscribe to it, and share it with others. See you in my next video. All the best!